CDC Director Rochelle Walensky orders an agency overhaul admitting flawed COVID-19 response. Walensky wants to boost transparency by releasing data more quickly and to improve communication with the public. The change comes after two recently conducted reviews that were done in April. One was done by Health Resources and Services Administration. The other was done by CDC Chief of Staff Sherry Berger. The first review specifically looked into the CDC's pandemic response, whereas the second review looked into the CDC's agency operations. According to a CDC statement, the reviews concluded that the, quote, traditional scientific and communication processes were not adequate to effectively respond to a crisis the size and scope of the COVID-19 pandemic. Nonetheless, Walensky has said that the CDC knew a pandemic like COVID-19 was going to come, so arguably maybe they should have been prepared. But nonetheless, Walensky says that the CDC was underfunded before the pandemic started, noting that the public health workforce was seriously depleted. She now says it is her duty and the agency's duty to fix that. In March 2020, so just as the pandemic started, a Pew study showed that 79% of Americans said public health officials were doing a good job responding to the pandemic. But that number dropped to 52% by May of 2022, so nearly 2 years later. The decreased approval rating came as many people were confused by the CDC's ever-changing guidelines regarding COVID. So there were times where people weren't sure if COVID was an airborne virus, if masks were effective. Guidelines were constantly changing, and especially as different strains of COVID came out, the rules were different. For Omicron, the rules were different. For Delta, the rules were different. So it left people confused and a little bit frustrated with the CDC's transparency and data and information. So we know that the CDC is doing this overhaul, but what kind of changes can we expect? So first and foremost, nothing is going to happen immediately. The CDC is huge. I mean, there's a lot of moving parts here, but changes will slowly start coming. Former Health and Human Services Deputy Mary Wakefield has been appointed to lead a team overseeing the agency overhaul, as well as creation of a new executive council built by Wakefield and reporting to Walensky, who is that CDC director I keep talking about. The point of the executive council will be to determine agency priorities, track progress, and align budget decisions with a bias towards public health impact. This council hasn't yet been established, but will apparently come with time. In terms of transparency, the CDC has started revamping and streamlining its website to create simplified public health guidance. The agency is also considering measures that will speed up the publication of data and scientific findings, because what they found during COVID was that information and data were taking months to be released. So by the time they were released to the public, this data was already months old. So basically, the CDC has promised to revamp the website so it's easier for people to navigate, work on sharing information faster in a plainer language so it's easier to understand, and develop a more nimble workforce that can quickly respond to public health crises and get information out quicker and more efficiently. So I'd like to ask you, I always pose questions for you guys to get you guys thinking about issues. How do you feel after hearing this? Do you agree that the CDC needs to make these changes? Do you feel they could have done better with how they handled the pandemic? Are you one of those in that study that felt in March 2020 that they were handling it great, and then by, this year you were like, they haven't handled it well at all? And finally, what changes would you like to see them make? So obviously we have those proposed changes that I went over, but is there anything else that you think the CDC can include in this agency overhaul to make them better? So all good things to think about. Issues like this, it's really important to kind of think for yourself and get that brain thinking a little bit to form your own opinions. So with that, if you want to see some sources about this issue, such as the CDC director talking herself and explaining these things herself, I always have them linked on my website, jordanismylawyer.com, and you can find them in the episode description for my August 22nd podcast episode. So everything will be there for you, and make sure to watch my next video, which is about a abortion case in Florida where a parentless 16-year-old girl was denied the ability to get an abortion.